PSC നേഴ്സിൻ്റെ പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. മെഡിക്കൽ സർജിക്കൽ നേഴ്സിംഗ് ക്വസ്റ്റ്യൻസ് ആണ് നമ്മൾ ഈ വീഡിയോ ഡിസ്കസ് ചെയ്യുന്നത്. 14ാം ഭാഗം വീഡിയോ ആണ് ഇത്. ഈ വീഡിയോ കാണുന്നവർ മുഴുവനും കാണാൻ ശ്രമിക്കുകയും പഠിക്കാൻ ശ്രമിക്കുകയും ചെയ്യുക. ഇതിനു മുമ്പും അനേകം വീഡിയോകൾ ഈ ചാനൽ ഉൾപ്പെടുത്തിയിട്ടുണ്ട്. പ്രീവിയസ് ക്വസ്റ്റ്യൻ പേപ്പേഴ്സ് ഉൾപ്പെടുത്തിയിട്ടുണ്ട്. സിലബസ് എന്നുള്ള വിവിധ ഭാഗങ്ങൾ ഈ വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിട്ടുണ്ട്. പഠിക്കാൻ ശ്രമിക്കുക. പഠിക്കുന്ന എല്ലാവർക്കും വിജയാശംസകൾ നേരുന്നു. അടുത്ത മാസം നമുക്ക് പരീക്ഷയുണ്ട്. ആ ഒരു തോന്നലോടുകൂടി സമയം ഏറ്റവും നന്നായി വിനിയോഗിക്കാൻ ശ്രമിക്കുക. പഠിക്കുന്ന എല്ലാവർക്കും വിജയാശംസകൾ നേരുന്നു. നന്നായി പഠിക്കാൻ കഴിയട്ടെ. പുതുവർഷം എല്ലാവർക്കും അനുഗ്രഹത്തിൻ്റെയും നന്മയുടെയുമായി തീരട്ടെ എന്ന് ആശംസിക്കുന്നു. നമുക്ക് വീഡിയോയിലേക്ക് കടക്കാം. The nurse is caring for a client with a diagnosis of Crohn's disease. When evaluating a client's response to healthcare intervention, which expected outcome is most important for this client? The nurse is caring for a client with a diagnosis of Crohn's disease. When evaluating a client's response to healthcare intervention, which expected outcome is most important for this client? Gains a half pound per week. Gains a half pound per week. Laboratory value findings in a client with disseminated intravascular coagulation or DIC. Thrombocytopenia. Bronchovesicular sounds are heard over main stem bronchi. Broca's area is located in dash frontal lobe. Infectious mononucleus invade cells, B cells. A client is suspected to have cardiac tamponade. Which findings in QRS complex of a lead to ECG will support the suspicion? Amplitude decrease. Increased prothrombin time is seen in patient on oral anticoagulant. What is the clinical indicator of end-stage renal disease? Azotemia. Azotemia is an elevation of blood urea nitrogen or BUN and serum creatinine levels. The laboratory results indicate a ratio of blood urea nitrogen to creatinine of 15:1. The nurse determines what this result indicates. A normal ratio. Hepatitis B infection is associated with which malignancy? Hepatocellular carcinoma. Pink puffer is known as emphysema. Presence of protein in urine output is known as dash proteinuria. A nurse is directed to administer a hypotonic intravenous solution. Looking at the following labeled solutions, she should choose 0.45% NS. A patient with acute renal failure becomes confused and irritable. These features occur due to increased level of BUN. Assessment shows that the RBS of patient 40 mg percent. The immediate management is to administer 50% dextrose IV. The nurse is caring for a client with a diagnosis of necrotizing fasciitis. The nurse understands that the primary concern this time is skin integrity. Which part of the pancreas is at risk for developing cancer of the most? Head of the pancreas. Position given to the patient during vaginal surgery increases the risk for DVT or deep vein thrombosis. Cullen sign means discoloration of periumbilical area. Edema, distended jugular veins, nocturia and weakness are the symptom of right-sided heart failure. A client is complaining of fatigue, weight loss and a low-grade fever and pain in fingers, elbows and ankles. These symptoms are suggestive of a client is complaining of fatigue, weight loss and a low-grade fever and a pain in fingers, elbows and ankles. These symptoms are suggestive of rheumatic arthritis. Which forms of muscular dystrophy is most common? Duchenne's. A client admitted to emergency department has ketones in the blood and urine. Which situation associated with this development should be the nurse's focus when collecting additional data about this patient? Starvation. The most common complaint of patients with the disorder in the inner ear is dash. Tinnitus. A client arrives at emergency department with a penetrating eye injury from wound chips. What is the initial nursing action? Perform the visual acuity test. What is the common clinical manifestation of pulmonary embolism? Dyspnea. Most common pathogenic organism responsible for septic arthritis? Neisseria gonorrhoeae. Differentiation of various cardiomyopathy is done with the help of diagnostic test. Echocardiography. Alpha cells of pancreas secrete glucagon. The nurse prepares a client for insertion of a pulmonary artery catheter. The nurse explains to the client that the catheter will be inserted to provide information about left ventricular functioning. Definitive diagnostic test for TB is dash. Sputum culture. Symptom help to differentiate between hemorrhagic stroke from a thrombotic stroke is dash. Sudden onset of severe headache. The clinical manifestations of fractures include pallor, pain and paresthesia. Diabetes insipidus client can be presented with low specific gravity urine. What must the nurse do when preparing a client for a computer tomography scan? Explain the procedure. An example of cardiac tumor. Myxoma. Injury to which part of the brain affect temperature regulating mechanism? Hypothalamus. Lugol solution is also known as dash. Saturated solution of potassium iodide. Pantoprazole is dash. Proton pump inhibitor. The complication that occurs during hemodialysis as a result of cerebral fluid shift is dash. Disequilibrium. The sputum specimen should be delivered to laboratory within 2 hours. While pacemaker catheter is being inserted, the client's heart rate drops 38 per minute. What medication does the nurse expect the physician to order? Atropine. Skin manifestation commonly seen after 2 days of radiotherapy is dash. Erythema. CVP is inserted to measure dash. Right ventricular end diastolic pressure. Electrolyte imbalance seen in hyperparathyroidism is dash. Hypercalcemia. Bacteriuria is dash. More than 105 colonies of bacteria per milliliter of urine. Treatment for gonorrhea includes both ceftriaxone and doxycycline. Chance of coexisting chlamydial infection. Arterial blood gas values shows pH 7.5, PCO2 30 mmHg, HCO3 25 MEq. The nurse interprets these values as indicating dash. Respiratory alkalosis uncompensated.